Well, good morning, everyone. Welcome to the White House. We are delighted to have you all here. Thank you, Gautam, for that wonderful introduction, as always. I would like to recognize that we've been joined by Secretary Sebelius. Secretary, if you would like to acknowledge. And I'm also always enthusiastic about recognizing Congressman Barbara Lee for all of her efforts in the area of fighting HIV/AIDS. We've been on the circuit together. We've been traveling all around, and it's always a pleasure to have you here with us today. And I'm delighted to have so many other folks who care so much about this issue here with us this morning. So 3 years ago, President Obama launched the National HIV/AIDS Strategy, a concise plan to move our country forward to reduce HIV incidence, increase access to care, and reduce HIV-related disparities. This strategy was a product of thousands of conversations, including, I know, many of you in this room, and it affirms the President's commitment to end this epidemic. Since the release of this strategy 3 years ago, we've made important strides in understanding how to best prevent and to treat HIV. You'll learn more about these advances today. But first, I wanted to share a personal story and why this issue is so important to me. Some of you may have heard that nearly 20 years ago, I lost my sister-in-law to AIDS. And part of the challenge for her was at a time where her physician, it never occurred to him that that could be what was wrong with her. She didn't fit the stereotype back then. And so she went for a very long time without any treatment, and in the end, it proved to be too late. And she left behind my niece, Tracy, and her husband. And I've always thought, my goodness, what if she had been treated right away? Perhaps she would be here with us today. And so I know for so many of you here, it is personal. You've lost family, you've lost friends, you have people with whom are part of your life who are living with HIV. And it is that commitment that really propels us, and those stories that I know are in each of our hearts, that makes us decide that we're going to get up every day and fight so hard to end this epidemic. It's true across President Obama's administration. Last year, in concert with the International AIDS Conference, which I have to say we were so delighted to be able to host finally back in the United States because of the ban that was ended. So in connection with that conference, we released a series of videos from folks within our administration who spoke about how HIV/AIDS had touched us all. So I did a video, Cecilia, who you just met, did one, Grant, the First Lady's Chief of Staff, Tina Chin, and we think it's so important to keep our message personal, to tell those stories. Because as you tell those stories, it's a way of not just educating people, but winning over their hearts as well as their minds, and engaging so many people in this battle that we share together. The President met people who are living with HIV during that time, and he honored them for their advocacy during a reception here at the White House. And just seeing the expressions on the faces of the folks who were here, and the fact that he touched them and expressed on his personal level how much their battle meant to him as the President of the United States, was a moment I won't forget anytime soon. So I know this year, as we have continued to hear stories of heartbreak, we've also heard stories of inspiration. And I have met so many people, particularly young people, who are living with HIV and have figured out how to meet that challenge head on. And Alicia Keys and I attended an event really over a year ago with Grant, and we spoke with a group of African-American women here in D.C. who are all HIV positive. And as you all know, D.C. has been almost like ground zero in terms of HIV. And to meet these women, some of them were young, some of them were middle-aged, some of them were older, telling their stories is really what deeply moved Alicia to launch her new initiative. And she was back here a few months ago launching her initiative, where it's really all about empowerment. And she included in it several of the women who she'd met last year with the goal of educating people and empowering people to get treated, take care of themselves, get tested, making sure that they're telling their story so that we're educating everyone. So I hope that in today's world, people like my sister-in-law, Julie, would have been tested, since it's now recommended that everybody between the age of 15 and 65 be tested. And when that happens, of course, better care ensues. Unfortunately, we also know that there are still significant gaps along with what we call the HIV Care Continuum, which is the progression from the diagnosis to receiving optimal treatment. And it's the steps of care that a patient receives from the time they are very first diagnosed to when they are fully and appropriately treated. Many of you are familiar with the statistics. Nearly a fifth of the people living with HIV in the United States, about 200,000 people, aren't yet diagnosed. In addition, most people who are diagnosed do not receive ongoing care for a wide variety of reasons. And perhaps most concerning, only a quarter of the people living with HIV have the virus under control. That's just 1 in 4 people in our country, here. That's not good enough. It's not good enough for the president, and I know it's not good enough for any of you who are here with us today. We need to make sure that 4 in 4 are treated. 4 in 4, isn't that right? So that's why I am delighted to announce that today President Obama will be signing an executive order creating the HIV Care Continuum Initiative. He's directing federal agencies to address the continuum of care by increasing testing, services, and treatment, and by promoting successful HIV testing and service models. We're also going to encourage innovation to address the barriers to access to treatment and testing. And we're establishing a working group that's led by Dr. Colfax and Dr. Coe to help coordinate these efforts and provide recommendations directly to the president. These are incredibly important steps that we're taking to begin the end of AIDS. And when I think about the importance of early diagnosis and treatment, I think about a young woman who I met, Stephanie Brown, who was here for our event last year. Last December, the White House hosted this World's AIDS Day panel, and Stephanie was one of our panelists, and she is just an amazingly courageous young woman who was diagnosed with HIV at the age of 19. Today, she's an advocate for greater awareness of HIV/AIDS, and she speaks at community centers and to audiences all around her hometown of Fayetteville. She also hopes to start an HIV advocacy group. Stephanie has used her condition to motivate and to empower both herself and make a difference in the lives of others. And I'll never forget, she said to me, "I'm here for a purpose, to help others, and I'm not going anywhere until I'm done." What an amazing attitude from one of our young folks. And I know that this is the same passion and mission that we all share, and that's why we're here. And so I want to thank you for your efforts, for everything that you've done so far, but also, more importantly, for everything I know we are yet to do together as we, once and for all, end HIV/AIDS. So thank you very much, everyone, and I'm going to turn it back over to Gautam.
Thank you, Valerie, for taking some time to join us this morning. Our next speaker also needs no introduction, and I am truly honored and privileged to be able to introduce her because of her leadership and commitment to ensuring that the health and well-being of all Americans is a priority for this administration. So please join me and give a warm round of applause to the Secretary of Health and Human Services, Kathleen Sebelius.
Well, good morning, everybody. I am really delighted to have a chance to celebrate this incredibly important anniversary with all of you and look at some of the important strides we've made and, as Valerie said, focus on where we still have work to do. I want to join Valerie in recognizing and thanking Congresswoman Barbara Lee, who spends an extraordinary amount of her time and energy making sure that the focus on HIV/AIDS is not lost on anyone. So again, thank you. It's great to join Valerie and Cecilia and Dr. Grant Colfax and others highlighting the tremendous work being done to improve the health and well-being of millions of Americans. I know we will be joined in a little while by our Surgeon General, Dr. Regina Benjamin, and I want to particularly recognize her efforts in this field. Tomorrow is Regina's last day in this great role, but I can tell you she intends to continue her health work on into the future, and we are all grateful for her service. I am thrilled that President Obama is signing the executive order creating the HIV Care Continuum Initiative, because it's a way to, again, focus efforts and bring us all together around a strategy which we think is so important. We have some great health leaders in our department who have been working on HIV/AIDS for a long time, from the research end to the clinical end, and they continue that work, but particularly the leadership of my Assistant Secretary of Health, Dr. Howard Koh, and Ron Valdesari from his office are continuing to mobilize our efforts to implement the National HIV/AIDS Strategy. And thank you very much, Howard, for the work you're doing. So today is an important milestone. 3 years ago, President Obama launched the national strategy, and I think there's no question that there is a new domestic sense of direction and purpose in our fight against HIV and AIDS here at home. The number of people living with the HIV infection in the United States continues to increase, and that's good news because it means people are actually living longer. So there are more people identified with HIV, but the number of new infections per year hasn't changed significantly, and that is also somewhat good news. At least we have stopped the tide of new infections. So it's a testament to the tremendous impact of existing HIV prevention interventions and the quality of HIV medical care and treatment. But the bad news is we still lose far too many people in the United States to HIV and AIDS, particularly men who have sex with men of all races, African American and Latino heterosexuals, and women whose single greatest risk factor is sexual contact with a male partner or husband who may be unaware of his HIV infection. But because we have many of the tools we need to bring about an AIDS-free generation, we have an urgent public and moral imperative to do that. So we're taking an important step in meeting the goals of the National HIV/AIDS Strategy by implementing the Affordable Care Act, and the last piece of that implementation begins to occur this year. I think that there's no question Obamacare is one of the most important laws in history in our fight against HIV and AIDS. Already, the law's expanded access to HIV screening, and it will this year end some of the worst insurance company abuses, like denying coverage for pre-existing conditions, including HIV infections, and putting a lifetime cap on care when patients need it most. Those days are coming to an end, and that's very, very good news. Coming this October, online health insurance marketplaces will open in every state in the country, and many states will be expanding Medicaid, particularly for childless adults. And that is a huge step forward for the approximately 15% of Americans who still have no health coverage. So it means that affordable, available coverage with essential benefits, including HIV screenings, prescription drugs, and quality medical care, will be finally within reach of millions of Americans. Many people living with HIV won't have to wait for an AIDS diagnosis any longer to become eligible for Medicaid, and that is good news. We're also, as part of this effort, undergoing an historic expansion of behavioral health coverage, which will be one of the essential benefits in new health plans, and reducing inequities for people at risk living with HIV, including those with co-occurring mental or substance abuse disorders. So the law facilitates the achievement of the National HIV/AIDS Strategy's overall goals to help reduce new infections, improve access to care and outcomes of quality care, and reducing HIV-associated health disparities by finally bringing people fully into the health care system. The goals include fighting HIV stigma and discrimination, It includes advocating for the health of communities at greatest risk for HIV, including young, Black, gay men, and transgender people. It includes supporting research in order to find more prevention and treatment breakthroughs. And it means making smarter, more coordinated investments to fight the epidemic. And that's really what today's executive order on the care continuum is all about. As we know, and I think it bears repeating over and over again because the data is pretty alarming, that we think there are about 1.1 million people, 13 and over, living with an HIV infection in the United States. And we still have about 50,000 new infections a year. Almost 20% of those folks with an HIV infection are not aware of it and run the risk of preventable health problems and transmitting the virus to others each and every day. 2/3 of those living with an HIV infection, including people not yet diagnosed, are linked to quality care. Only 2/3. But it gets worse. Under 40% of folks living with an HIV infection are retained in care, and only 1/3 of those people are starting on health-preserving, life-extending antiretroviral medication. So we lose people at every step along the way, and we know that that's a continued problem. So because of that attrition, as Valerie said, about 1/4 of people living with HIV accrue the full benefits of what we know to be the best possible care and the most modern care. 825,000 people are lost in the steps in the continuum. We know those steps are necessary to halt the virus, to halt the adverse effects on health, and to prevent transmission to others, and we're losing that many people each and every year. So at HHS, we're moving forward with projects designed to address many of the factors that lead people to fall out of the care continuum. And here's some of the things that we're doing. NIH has expanded its investment in integrated behavioral and biomedical research to address gaps and opportunities in the HIV care continuum. Our substance abuse and mental health services is investing in screening and assessment for people living with HIV and in need of mental health or substance abuse treatment, which we know causes problems staying on care. We know that one key intervention that helps someone stay on their HIV treatment is to provide effective intervention for alcohol and substance abuse, and so we're going to refocus on that effort. Our Health Resources and Services Administration, in charge of the workforce, is working to identify best practices to build workforce capacity in community health centers to address each step in the care cascade for persons living with the HIV infection. Now today I'm proud to announce a new demonstration project that builds on those ongoing efforts. HRSA, the Office of the Secretary of Health, and the Centers for Disease Control and Prevention will collaborate to expand the capacity of community health centers, local health departments, and their grantees to better integrate HIV prevention and treatment across the continuum of care. The new demonstration project will invest $8 to $10 million a year for the next 3 years to support health centers and local health departments in integrating public health practice and clinical care. The project is targeted at areas with the highest numbers of racial and ethnic minorities who are disproportionately affected by the epidemic, and communities with the substantial unmet need for comprehensive HIV services. We anticipate that key outcomes of the new demonstration project will include increased HIV screenings at health centers, as well as an increased numbers in the people who are diagnosed, linked to care, retained in care, treated, and achieve viral suppression. So these kinds of investments improve HIV prevention and care, but also address the barriers that can disrupt the continuum of care. And they're made possible by the incredible coordination among our dedicated agencies and world-class staff. So today, more Americans have better access to health-preserving, life-extending HIV prevention and medical care life-saving interventions than ever before. Because of the work we're about to do together. We want to save more lives and usher in an AIDS-free generation. We know that's within reach, and we have to reach out and get it. So I'm grateful for all the work you do in this critical effort, and we look forward to being good partners in the years ahead. Thank you all very much.